show you the examination of the hip joints of this patient. Before doing this, I will introduce myself to the patient, tell him to tell me if I am causing him any pain and get his consent. මම වෛද්‍යවරයෙක් උකුල් ප්‍රදේශයේ පරීක්ෂා කරන්න කමන්නේ. What වේදනාවක් ඇතිවෙනවද මට ඒක කියන්න. On inspection, I will be looking for any muscle wasting, any swelling of the hip joint area, any redness, discharging sinuses, and surgical scars. I will be looking at him anteriorly, from the side, and as well as posteriorly. The testing of the specific muscles and the movements will be done under lower limb examination of the neurological system. I wouldn't repeat that, but I will tell you 2 specific tests you have to do for the hip joint. The first one would be the Trendelenburg test. The second would be looking for a fixed flexion deformity of the hip. I will start with the Trendelenburg test. In this, I will ask the patient to stand on one leg. When doing this, you can notice his pelvis has tilted upwards. That is because the contraction of the abductor muscles of the hip girdle on this side. If we had a problem of the abductors, then he would not be able to stand. He would wobble on trying to do this. This could be due to a fracture of the neck of the femur or a weakness of the abductors on the side he is standing on. So in this patient, if there was wobbliness on standing, the pathology should be on the right side. Then I will examine the gait of this patient. Then calendar, the right to the calendar. His gait was normal, but I would be especially looking for an antalgic gait due to pain, where the patient will be dragging his foot, or a wobbling gait if the abductors of this patient were weak. Now, I will look for a fixed flexion deformity of his hips. For this, I will put one hand under his lumbar area and then ask him to flex one knee towards the abdomen. While doing this, I must feel the pressure of his spine on my hand. Now I will examine for any flexion deformity of the other hip joint. Ideally, this hip should be completely at the level of the bed. If this hip is raised, that angle corresponds to the angle of fixed flexion deformity. Thank you. Then I will thank the patient for his cooperation.